Thank you. Good afternoon. I'd like to thank IFA for supporting my participation in this very important conference. I would like to share with you right now the efforts of the Philippines on how they're going about to achieve their goal to eliminate rabies by 2020, which is consistent with the goal of the ASEAN member state countries wherein we have agreed to eliminate rabies in the ASEAN Plus region by 2020. Allow me to briefly give you a short background of what the rabies control program in the Philippines. The National Rabies Control Program is a program implemented by a multi-agency, multi-sectoral National Rabies Committee, chaired by the Department of Agriculture and vice-chaired by somebody from the Department of Health. It's composed of members from at least four national agencies, which are the Department of Agriculture, the Department of Health, the Department of Interior Local Government, the Department of Education, and the Department of Environment and Natural Resources for Wildlife. And we do have representatives from the local government units who are the implementers of the program, some non-governmental organizations, and people's organizations. So these are the members of the National Rabies Committee. As I've said earlier, the goal of the program is to eliminate human rabies in the Philippines and declare a rabies-free Philippines by year 2020. I'd like to give to you a short background of how we've been working at the National Rabies Program in the Philippines, how we've been collaborating for the past how many years before we started working on the Gates Foundation funded, supported project in the Visayas region. Well, the collaborative effort between the Department of Health and Agriculture Control and Eliminate Rabies started in the late 1980s. It was formalized in 1991 with the signing of the Memorandum of Agreement among the secretaries of four different national agencies, the Secretary of Health, Agriculture, Education, and Interior Local Government. Recently, a national law which is called Republic Act 9482 or the Anti-Rabies Act of 2007 was enacted into law by our Congress, which provided the legal mandate for the creation of a multi-agency, multi-sectoral national rabies prevention and control program. How are we collaborating with each other in order for us to eliminate rabies? Well, at the national level, the collaboration then was quite limited, like in the crafting of national law and providing guidance to our local government units on how to implement the national rabies control program, both from the animal and human health sides. And of course, in the celebration of the Rabies Awareness Month and the World Rabies Day. And for the Department of Health, we were quite focused then on the provision of post-exposure prophylaxis to all rabies exposures and provision of pre-exposure prophylaxis to high-risk individuals, while the Department of Agriculture was mandated to do dog vaccination against rabies, although the vaccines was quite limited. And in fact, the vaccines that are being procured by the Department of Agriculture is not even enough to vaccinate at least 20% of the estimated dog population in the country. Collaboration at the national level is very, very limited. And the same way at the national level and local levels, at the provincial, city, and municipal level. And because of these efforts to control rabies then was quite fragmented. Each agency doing their own business in eliminating rabies, and we're not trying to work together in order for it to eliminate rabies. However, in 2009, the Philippines was selected as one of the three countries to implement the Gates Foundation funded supported rabies elimination campaign in three different countries, which is the Philippines, South Africa, and Tanzania. The objective of the project was to prevent human rabies through the control and eventual elimination of canine rabies, creating a paradigm shift for human rabies prevention in Africa and Asia. Well, for us in the Department of Health, we've been focusing on post-exposure prophylaxis. This is indeed a paradigm shift because we were tasked to implement a project wherein the main focus is dog vaccination. The human health implementing a dog vaccination in the Philippines. For us to implement it successfully in the Philippines, we really need to collaborate with the animal health sector from the Department of Agriculture in order for us to vaccinate enough dogs and hopefully control rabies in the project sites. The secondary objective of the project is to develop models on community village approach on rabies elimination strategy that can be replicated in other provinces, cities, municipalities, and the Philippines. We have developed at least 4 or 5 models. With this project, we're able to develop at least 4 to 5 projects on the different aspect of the implementation of rabies control, both on the animal and human health side. The project site is, the selected project site was the Visayas Island, composed of 3 regional regions, mainly your Eastern Visayas Island of Region 6, Central Visayas of Region 7, and Eastern Visayas of Region 8. Composed of 15 provinces, 39 cities, 37 municipalities, 12,069 barangays, and we're targeting at least 2 million dogs, or about 21 to 25% of the dog population in the country then. Our approach to the rabies elimination campaign in this Gates Foundation supported project was it should be multi-agency and multi-sectoral. So at the national level, we're implementing, we are working with at least 4 national agencies, which are all members of the National Rabies Committee, the Agriculture, the Health, Education, and Interior and Local Government Agency. But at the regional, provincial, and local level, they have involved other national agencies like the Philippine National Police, the Public Information Agency, and other national agencies that could help them in the implementation of the program. We do have international and local partners in the implementation of the project. The collaborative effort to control rabies in the Visayas project was sharing of resources, meaning say the agriculture side putting some resources in order for us to achieve the objective, the human side putting resources, and as well as our international partners. So not one just agency supporting the project, but all the other stakeholders are putting some resources in order for us to achieve the goal of the project. Sharing of responsibilities, like using our community health volunteers in the dog vaccination campaign of our villages, and of course in the training, we've been using our EPI cold chain managers in training our dog vaccinators to improve their cold chain management, the cold chain management capabilities of our dog vaccinators and so forth. And of course, one of the biggest thing that we would like to prevent in this project is you would like to avoid duplication of work, like 1 or 2 agencies or international NGOs and other partner agencies working on the same thing but not talking. So collaboration is very important in order to avoid wasting resources, at the same time ensuring that no work is being duplicated by one agency or one non-governmental organization. Our approach is consultative, meaning to say all stakeholders are consulted, and we do regular program implementation review and planning workshops in order to improve the implementation project. We do all the consultations and planning at all levels at least once a year. We have one at the national level, one at the regional level, one at the provincial level, all involving both the animal and the human health sector. And of course, we do have different committees where all partner agencies and members of technical organs talk and discuss issues and concerns affecting the implementation of the program, as well as on how to improve the provision of the services, especially to the far areas which consider hard-hit areas. At the national level, we have the National Rabies Committee, and at the regional, provincial, and level, we have the regional and provincial rabies technical working groups. And these are at least the minimum numbers of partners in the project. We have the Department of Agriculture, Department of Interior, local government units, Department of Education, the local government units of the Philippines, and some international partners which have been helping us for the past several years. We have the World Health Organization, the Gates Foundation, the WSPA or the WAP, and of course from the University of Glasgow Medical Research Council. And we have other national agencies from the Philippines. The implementation of the project typically starts at the national level. Well, all partner agencies, including NGOs, if they want to be involved in the project, should collaborate at the national level to ensure that, well, number one, no resources are wasted, no work is duplicated. At the same time, we are talking at the same level. Wherein we have the same target in or objectives in being involved in the project. From the national level, we have the central office people, and then we cascade all policies, agreements to the regional office through the regional health office of the Department of Agriculture and Department of Health. And of course, through the regional technical working group, they're able to cascade all the policies, objectives of the project to the different government units from the provincial, city, and municipal level. Initial results, we're quite happy with the initial results because we started the baseline data that we had in this project site was in 2009 when the 3 project sites were only vaccinating around more than 200,000 dogs. By the end of 2011, we were able to increase our dog vaccination by as much as 450%, by as much as 450%, 450%. The number of FAT, confirmed animal rabies, has significantly declined from 2009 to 2014, except for the increase in the numbers in 2013 when we were severely affected by Typhoon Haiyan. And the number of human deaths had significantly decreased from 2008 down to 2014. And of course, we were able to decrease 9 islands from the Visayas project sites as a rabies free zone, jointly declared by the Department of Agriculture and the Department of Health. 2 from Western Visayas, the province of Guimaras, and the island of Boracay. 7 from Central Visayas, 5 from Central Visayas, the province of Siquijor, the island of Apo Island, Camotes, Malacascoa, and Olympia Island. And 2 from Eastern Visayas, the province of Biliran, and island municipality of Limasawa. Because of this experience, because of this success in some areas in the Visayas project, and the declaration of some parts of the country as rabies free zone, in 2014, when the Department of Health developed our DOH-KP roadmap, or the Health for All roadmap, which is the priority projects or programs of the Department of Health until the end of 2016, when the end of the current administration end. We are fortunate that for the first time, the National Rabies Program was included among the priorities of my secretary. By being one of the priority programs in the Department of Health, the budget of the National Rabies Control Program has significantly increased from 72 million pesos in 2009, we were able to increase it to 409 million in 2015. Most of this money are being spent on post-exposure prophylaxis. It was also in January, I'm sorry, that should be 2014. January 2014, right after being identified as a priority program in the Department of Health, my secretary, then Secretary of ONA, requested a meeting with the Secretary of Health, Agriculture, and to discuss how we're going to eliminate or reduce the incidence of human rabies in the country. And with that, we were able to sign a Memorandum of Understanding in May of 2014, wherein our secretary then, DOH Secretary ONA, and the Secretary of Agriculture, Secretary Alcala, signed a Memorandum of Understanding to further strengthen the collaboration on rabies control. It was also during that time that Department of Health ceremonially transferred 69.5 million pesos to the Department of Agriculture in order for them to procure dog vaccine. The Department of Agriculture can only procure around 30 to 35% of the dog vaccine requirement of the country. So what my secretary did in 2014 was to transfer 69.5 million pesos to DA in order for us to provide additional 50% of the dog vaccine requirement of the country. And by that, we'll be able to at least procure 80% of the dog vaccine requirement of the country. So as we start our collaboration with the Department of Agriculture, I would like to share with all with you these parting words based on the experience that we had in implementing the project, in the Visayas project. In a country where resources still with rabies are limited, much can be achieved if all stakeholders, including international partners and non-governmental organizations, coordinate with each other to avoid duplication of work. Gaps can be addressed by sharing of resources, and benefits can be maximized if the burden of the disease is considered in the selection of project sites. Lastly, collaboration should always start from the planning and, if possible, at the conception of any rabies elimination project. So I'd like to share to you some pictures that we have done, we have collected from the different sites. So this is from the Western Visayas. This is from the Central Visayas, and this is from the Eastern Visayas. And of course, these are some pictures of the different people at different level working for the Rabies Free Visayas project. With that, I would like to thank you. And these are the members of the National Working Group for the Rabies Free Visayas project. Dr. Mestan then was one of our favorite WHO consultants helping us in the implementation project. Thank you.